Hey, everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three. I'm trying something new tonight. I am broadcasting live. So just trying something different. I was a special guest for Global Christian Ministries for Medicine with Dr. D. I did a special on COVID-19. And then I just got some requests if I could do it live because people felt that they would be able to ask more questions live. So this is new to me. So just bear with me for 1 second. If you're watching, share the video. Definitely don't forget to subscribe. Let me get on here. Again, thank you for being so patient and bearing with me as I get on here and do this. Let's see. I hope everybody is having a good night. Let's see. I'm just sharing this. Sorry about this. Everybody, thank you for being so patient. And I hope you guys are being careful during this time with COVID-19. It has been crazy, 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 crazy. All right. Thanks for being patient again. I'm super excited. Don't forget that the Dr. Mom Show is a medical informational show. It does not take the place of your physician or your child's physician. So definitely remember that if you need medical advice, definitely seek that from your physician or your child's physician. All right. Well, again, you can check this out on YouTube. If you have any questions, definitely don't hesitate to post it. And we're going to get right into it. I am excited about this. Let's do it. See, I'm still learning this thing. All right. Well, awesome. Well, today I'm super excited because we are going to be talking about how not to lose sleep over COVID-19. That's right. A lot of times people are losing sleep now with anxiety, depression, and insomnia is also affecting a lot of people. So this is definitely something that has become rampant. So we will be talking about insomnia. Before we delve into our topic, I just want to remind you, check me out on my website, www.delinemushalak.com. And my mom devotional is now available in ebook on amazon.com, and I'm super excited about that. Don't forget, you can also purchase your copy of my international bestseller, The Tripsies and Me, either from Amazon or my website. That is also available in an ebook. And then I'm super excited about my first book collaboration that I'm spearheading called Women of War, Peace in the Midst of the Storm. You can pre-order that on my website, www.delinemushalak.com. So super exciting things. Don't forget to like the video, share it, and subscribe to my YouTube channel. So again, today we're going to be talking about insomnia. So what is normal sleep? So normal sleep is when a person takes anywhere from 10 to 20 minutes. So again, no more than 20 minutes to fall asleep. And if they wake up in the middle of the night, it takes them less than 30 minutes to fall back asleep. So remember that, because when we talk about insomnia, that means that a person takes greater than 30 minutes to fall asleep and are also awake for more than 30 minutes if they get up to go to the bathroom. Don't forget, if you have any questions about insomnia or any thoughts about future topics, definitely throw those up in the comments. Now, insomnia itself can be either short term, and short term just means that it's less than 3 months that a patient's been having issues. And a lot of this is situational. So, the perfect example is acute changes such as COVID-19, that people are having more anxiety and having a harder time falling asleep. In addition, people are kind of off of their normal routine. Now, long term or chronic is if a patient is having issues falling asleep or staying asleep for more than 3 days a week or for more than 3 months. That is what we consider chronic. So, what happens is there's primary insomnia, which means that, you're just like, I can't sleep. So, for example, people who may not have had any medical issues or any psychiatric issues in the past, now with COVID, they may feel a little anxious or again off their routine, that they may say like, oh, I just can't fall asleep like I usually do. Um, and then there's secondary, and secondary means that there's some underlying reason. So the underlying reason is psychiatric. So again, it can be if they have depression or anxiety, bipolar, schizophrenia, if there's any medical diagnosis. So things like if they have prostate issues, so they wake up at night due to their prostate being enlarged and pushing up against their bladders. Then, of course, medication. So if people are taking a water pill, that can cause them to get up in the middle of the night more. Or if you're taking a stimulant, if somebody has ADHD, so attention deficit or hyperactivity disorder, that may stimulate them and, keep them up later. Also, drug use. So drug uses like stimulants, of course, things like cocaine that stimulate people, that can keep you up. So definitely there are a lot of other things that contribute to it. And another thing is other sleep issues. So things like obstructive sleep apnea. So people who snore and they don't get enough oxygen, people who have narcolepsy where they're falling asleep during the day all the time. If you've ever seen somebody with narcolepsy, it's not funny, but it is kind of funny what happens. And then of course, now there's people who work night shift. So there's a night shift sleep disorder. So of course, these patients are working at night. They come home in the morning and they have to try and get some sort of sleep. And a lot of times they have issues falling asleep. So again, there's a lot of things that play a role in our sleep hygiene. So we have to be mindful of that. So if you are having issues sleeping, you really need to make sure you see a physician and think about all the questions they're going to ask: your daily routine, how are you sleeping, how are you falling asleep, and other things that could potentially be affecting you. So when somebody has insomnia and they're not sleeping right, this really messes you up all the time, like 24/7. You can get fatigued and stressed. You're just like, oh my gosh, I can't handle this. You can have poor concentration. You can have issues with memory. So it's a lot of stuff that can happen. So even when you're in college and stuff, you pull those all-nighters. I mean, when I was in med school, I pulled all-nighters where I would stay up and study. But research has shown that when you do that, your short-term memory retains the information, but it doesn't go into your long-term memory. So you can cram and regurgitate it, but it does not go into your long-term memory. So just remember that. So lack of sleep does not help with your concentration or memory. And then, of course, if you don't sleep during the night, you're super tired during the day. So you're sleepy. And then some people end up taking a nap, and then it becomes a vicious cycle where you're tired during the day, you nap, and then when it's time to sleep at night, you can't sleep. Irritability, people get moody and start yelling, and they're sensitive. Stressed at work, where you're performing poorly, or you're performing poorly at school, or if you're playing sports. And also accidents. There's an increased risk of accidents if you do have insomnia. So this can definitely affect you in multiple ways. So this is something that's really important. So what happens? So let's say you go to the physician and what happens? So pretty much, again, we get a sleep history. How long does it take you to fall asleep? If you wake up, how long does it take you to fall back asleep? Do you fall asleep well, but you're waking up in the middle of the night, or you can't fall asleep? And once you fall asleep, you sleep through the night. So that diary and that time frame is good. How many hours do you sleep? Also, sleep hygiene. You hear us use words like that. What is your sleep hygiene, and what is your routine before you go to bed? So you definitely don't want to be watching TV or do anything super hyperactive when you're going to sleep, because that's going to get your adrenaline going. And I'll talk a little bit more about that in the treatment part. There's also some questionnaires that are used, again, that has very specific questions about your sleep regimen and routine. A physical exam is very important. Again, earlier I mentioned obstructive sleep apnea. So again, some people have more fat in their neck, so we can see a larger neck. Some people are a little bigger here. And of course, when we look in the mouth, we can see the size of the tonsils and look at that too. Labs, sometimes we may get labs because we may want to check your thyroid. If you're urinating a lot at night, usually if somebody is a diabetic, they usually urinate all through the day. But of course, again, if you're having issues, also your prostate, there's a prostate lab called a PSA, checking your kidneys, so there's just some baseline blood work that they would probably get. Then there's something called a sleep study, and a sleep study helps us to rule out things like restless leg syndrome, narcolepsy, obstructive sleep apnea, also how many times you're waking up during the night. So the sleep study, essentially, they attach all these stickies to your head, and you sleep in the sleep lab. And let me tell you something, the sleep labs are pretty awesome. It's like a hotel room that you sleep in. So they want it to be quiet. They don't want you to be bothered. And what they do is they're looking at your waves while you sleep. And I know you've heard of like REM sleep or REM. So that is your deep sleep, when you're in your deep sleep. So that's usually when you dream. So most people, sometimes they dream, they're like, oh, I slept so good. So that's your REM sleep. That's your deep sleep. And then, of course, a referral to a specialist. So usually pulmonologists or lung doctors are the ones who also do what we call sleep medicine. Some pulmonologists just specialize in sleep medicine. That's all they do are sleep disorders. So sometimes it's very specialized. So let's say you get a workup and you end up getting diagnosed. So what is next? So next thing that we would talk about is treatment. So of course, again, I mentioned sleep hygiene. So sleep hygiene is very important. So some big things, it's like a baby. You know how a baby has a routine, like you give them a bath, you lotion them down. I mean, who does not want a bath and to get a massage before bedtime? I take that. So sleep hygiene is important. So do something that's a routine. So take a warm bath. You can read a book, something that's relaxing to you. Read your Bible. You can pray, listen to some soft music. Again, you don't want to do anything too hyper or something that hypes you up. Also, you want to be careful. You don't want to fall asleep with the television on, because your subconscious, even though you're trying to fall asleep, your subconscious still hears what's going on. So it's still thinking and processing what is happening. Also, leave the bedroom for what is done in the bedroom. So we usually tell you don't do work in the bedroom or things that usually don't do. So love. This is for adults. So sex and sleep is what we say is exclusively for the bedroom. Everything else you should be doing outside, sitting up at your desk or in your living room or wherever you need to do it. Also, try to get your body acclimated to the time you go to bed, so then your body will know. So keep that time consistent. And I know now with COVID, again, it's hard because people are waking up later, so then they're going to bed later. So definitely try to keep your routine. You've heard me say that more than once, so that's really important. And then, of course, just what you do during the day. It depends. Some people can take naps. You shouldn't take a nap every day because, of course, studies have shown A good amount of sleep is good. You want about 7 to 8 hours of sleep per night, but too much sleep isn't good. Some studies have found that those people don't live as long too, but sleep is good for your immune system and also your health. So you have to find that balance. And then finally, of course, there's medications. So one of the first ones that gets talked about is melatonin. Melatonin is something natural that we make in our bodies. And with that, a lot of people like that because it's natural and we make it. It's not something artificial. A lot of people use that if they're jet lag and they've been on a long trip. So you can sometimes, hear people or see people using that. You can just get that over the counter. But then there's other medications such as trazodone. Then, of course, you have medications like benzos. We have benzos and non-benzos. Benzos are things like Xanax, Klonopin. Again, that works in two ways where it helps if people aren't sleeping because they're anxious versus people who just aren't sleeping. So the non-benzos would be things, I know you've probably seen commercials for Ambien or Lunesta. Now remember, all these medications have potential side effects such as being groggy in the morning, having vivid dreams. And again, because these medications help you go into that deep sleep, that REM, faster and for a longer period of time. And some of them even have the potential of causing you to sleepwalk. So these are things, again, that you want to discuss with your physician because they have to take what other disease processes you have going on and also what is best for you. So definitely just don't go trying things on your own. Definitely make sure that your doctor knows. So again, key points here is that ideally you should be falling asleep within 20 minutes of laying your head on the pillow. If you're waking up in the middle of the night to go to the bathroom, you should be also falling asleep in less than 30 minutes. Again, back again if you wake up. Now, if you're having any of the issues, again, I recommend that you speak to your physician, or if your child is having any issues, to speak to their physician. So again, I hope you guys enjoyed this video. It's been fun. Give me some feedback about the live video. I would love to know if this is better, if this worked. Of course, nobody asked me any questions today, and that was the reason I did it. If you have any topics that you want me to share, definitely feel free. Don't forget to reach out. You can reach out to Dr. Mom Gmail. So it's the Dr. Mom Show. Pulling it up right here for you. So you can reach out at drmomshow@gmail.com. And then, of course, you can check me out at DaleneMushalak.com. Don't forget to share the video, to like it, and subscribe. And I hope you guys have a great week. Stay safe. Love you guys. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Good night. Bye-bye.